There was an outbreak of measles in multiple states in the United States. The outbreak began in a rural country in Texas and has now spread to several hundred cases here. New Mexico, Oklahoma, and Kansas have also confirmed cases of measles. Measles is one of the world's most contagious diseases. It is also easily preventable with a vaccine. The viral infection can be serious for small children. Symptoms like coughing, runny nose, sore throat, fever, and skin rash are supposed to appear, usually 10 to 14 days after exposure. The measles vaccine was developed in the 1960s and is so effective that measles was declared fully eradicated in the U.S. in 2000. Under normal circumstances, the U.S. Centers of Disease Control for CDC recommends one dose of the vaccine between 12 to 15 months of age and another between 4 and 6 years old. It's important to know that measles has not been eradicated in many countries around the world. And outbreaks can happen because of imported cases and low vaccination rates. Local officials in states linked the measles outbreak are now concerned the measles virus could spread into high trafficked areas and vulnerable populations because of the contagious nature of the virus and low vaccination rates in some areas of the country. Experts expect the outbreak could continue to grow. U.S. Health and Human Services Secretary Robert F. Kennedy Jr. is publicly urging people to get the measles vaccine. And last from our Dr. Sanjay Gupta explains that measles is and why it's so contagious. Measles is one of the most contagious diseases in our planet. Now, like the flu or COVID-19, it can be spread through coughing, sneezing, even breathing. But the thing about the measles virus is that it can also linger longer. Picture this. If someone had measles and left the room 2 hours later, if someone who was unvaccinated walked in, they would have a 90% chance of getting measles. 2 hours later, it's also estimated that the person with measles would infect 9 out of 10 of their close contacts if their contacts are unvaccinated. Another reason it's so contagious that it can spread before symptoms can develop. That means you can spread it to other states before you start to get sick. This before those characteristic red spots appear. But the key here is vaccination. And because measles is so contagious, you need a really high level of vaccination. We are talking 95% of the community to help keep it at bay. That's why we see outbreaks occur in pockets of the country where that number has dropped. Now to news out of the Middle East, where Israel has ordered 6 UN schools in East Jerusalem to close within 30 days. The closures will mean roughly 800 students there may not be able to finish the school year. The schools were run by the UN Relief and World Agency for Palestinian Refugees, which operates schools for Palestinians in Israel-occupied areas. Israel has accused a handful of employees of the agency in Gaza of participating in the attack of Israelis on October 7, 2023. A claim the UN denies. Israel's Ministry of Education is now telling parents to register their students in other schools. But with the war in Gaza continuing, the education system for Palestinians in the region is in ruins, and with 70% of the school buildings there in Gaza have taken direct hits from Israeli airstrikes, and nearly a quarter of university campuses have been destroyed. The UN says no that nearly 800,000 students there have had any formal schooling for more than a year. Many of those schools were located within large areas of land that Israel seeks to incorporate into what the military has announced as security zones. Our Jeremy Diamond shows us how the military transformed part of the Gazan territory within about a half mile of the Israeli border into rubble. Inside Gaza, swaths of land closest to the Israeli border have been turned into a wasteland. Nearly every building within about a half a mile of the border fence have been destroyed. And we filmed this footage a year ago before demolitions were still ongoing. Over time, the Israeli military has raised about 22 square miles of Palestinian land, creating a buffer zone on about 60% of Gaza territory. Is a no-go zone for Palestinians. Some of them have been killed after setting foot inside the unmarked perimeter. Over the course of the war, this one-time economic hub was flattened. This video, which CNN located, shows the destruction of Gaza's only Coca-Cola factory. But it's not just factories. In the town of Fusa, hundreds of homes were leveled with a clear zone of destruction spanning about 1 kilometer from the border. Residential buildings, greenhouses, sheds, factories, you name it. It needs to be flat. That's the order. A sergeant major who served in Kuzas has said despite except for the UNRWA school and that small water facility, the directive was nothing left. He is one of those Israeli soldiers who described the demolitions and enforcement of the buffer zone to breaking the silence. An Israeli watchdog group that verifies and publishes soldiers' testimonials. The Israeli military did not respond to CNN's request for comment. More than 6,200 Palestinian buildings have been damaged or destroyed within 1 kilometer of the Gaza border, according to satellite analysis, including here in Al Bureij, where homes and acres of farmland were destroyed. Parkways Hasha, what animal is the first to use an external cardiac pacemaker? Mouse, rabbit, dogs, or cat? Meow. If it's that dog, you're doggone right. In 1952, doctors at the University of Toronto successfully paced the heart of a dog using an central electronic pacemaker, a medical device which is implanted in millions of people today, helping to stabilize their heartbeat. Today's surgeon, 10 out of 10 goes a pacemaker so small that it can fit in the tip of a needle. Scientists at Northwestern University say they have developed the world's smallest pacemaker. Smaller than a grain of rice, it can be injected into a patient's body without surgery. Normally, the medical device fits in the palm of a hand, typically about the size of a matchbox. Our deckline horror shows us how the device works and the tiniest patients it could one day help. It's about the same size as a sesame seed. They're calling this the world's smallest pacemaker. Engineers at Northfield University developed this device to be so minuscule that it fits inside a tube of a syringe and it can be injected right into a patient's chest, so no invasive surgery is needed. The pacemaker itself is light sensitive. It works almost like a small patch stuck to the skin. When an irregular heartbeat is detected, it flashes, and that light activates electrodes on the pacemaker, and then it sends electrical impulses to the heart, helping to control the pace of a heartbeat. While a tiny pacemaker can work with a heart of any size, it might especially benefit newborn babies with congenital heart defects as they recover from serious heart surgeries. Post-op recovery can be daunting, especially for infants who undergo that kind of surgery. The pacemaker isn't meant to be worn for life. It will dissolve away from over a period of 6 to 9 months completely. For now, this tiny piece of technology is still an experiment, but one day it could make a big difference for your youngest, tiniest heart patients.